my name is Nicole Kreisger, and today I'm going to be going over a few disability categories. The first category I'm going to be going over is autism. The IDEA defines autism as having a developmental disability that affects verbal and nonverbal communication. Many students with autism struggle with social interaction, perception, and cognitive abilities. According to the Center for Disease Population, about 1 out of 50 students have autism, and that's 5 times higher for boys than girls. Currently, scientists and researchers don't fully understand the causes of autism, but they do know it is a neurological disorder and not an interpersonal disorder. Some characteristics of an autistic child may vary. They can be resistant to change, have unusual responses to sensory stimuli, or have repetitive behaviors. Some other examples are listed on there of maybe overly touching, maybe sensitive to loud noises, delayed in speech development. Some ways to help students with autism in the classroom or at home might just be direct instruction in a natural setting, so maybe in the classroom, at home, ABA therapy, a high structured environment, positive reinforcement, and maybe having tons of reminders and checklists and assistive technologies. The next disability I'm going to be going over is intellectual disability. The IDEA best defines intellectual disability as a disability that limits both intellectual functioning and adaptive behavior as it's expressed in the conceptual, social, and adaptive skills. IQ and adaptive behavior are considered while determining intellectual disability in a student. People with intellectual disability can improve with tons of support and participating in activities. Around 1% of the population have an intellectual disability, and around 50% can be related to a genetic disorder such as Down syndrome. Many of the causes of an intellectual disability can also be unknown. Students may be easily distracted, have low maturity, difficulty in problem solving, or language comprehension. It can also just vary based on the student. So some ways to help the student in the classroom would be pre-teaching, having constant prompts and reminders, small groups, positive reinforcement, and assistive technologies. The next disability is an other health impairment, and the IDEA defines other health impairment as having a limited strength, vitality, or alertness, or heightened alertness to the environment or stimuli, creating a limited attentiveness. So this can look different for every student with an other health impairment. It can be asthma, ADHD, ADD, epilepsy, an immune deficiency disorder, Tourette syndrome, or diabetes. So school attendance can sometimes be inconsistent because of doctor's appointments. They might have difficulties with social skills. They might have some other psychological disorders such as depression or anxiety. They also just can miss out on some of the school experiences. So in order to implement some strategies, we can provide work or curricula when a student might be hospitalized for more than 2 days. Make accommodations for certain activities such as PE or sports. Provide a behavior intervention plan for some students that might have problems with some behavior. Provide social skills building and maybe some special moving equipment for mobilizing the children. The next disability is a specific learning disability. And the IDEA defines a specific learning disability as having one or more of the processing disorders hindering understanding of language, spoken or written, math, listening, and writing. Around 5% of children ages 6 to 17 have a specific learning disability. Some disabilities that fall under a specific learning disability might be dyslexia, perceptual disabilities, a brain injury, developmental aphasia, and also maybe some oral expression disorders. They may have trouble with phonological awareness, decoding, fluency, and vocabulary. They also might have some problems organizing their things and organizing their thoughts. They can be easily distracted and have dyscalculia. Some ways to help students with a specific learning disability may look like having peer support, pre-teach lessons, repeat readings and material taught, having reduced assignments, and the direct instruction with guided practice, independent practice, and proficiency. Lastly, we have a traumatic brain injury for our last disability. The IDEA describes a TBI as having a brain injury from an external violent blow or jolt to the head, causing damage to the brain tissue. This can cause psychological impairment. It can affect areas of cognition and memory. Students can also have difficulties with language and processing information. Some certain age groups that are at risk are children under 4 years old, and also teens between 15 and 19 years old. Around 3.1 million people have a permanent disability due to a traumatic brain injury, but brain injuries can also heal over time. Some strategies that can be implemented in the classroom or at home to help a student with a traumatic brain injury might be assistive technology, voice to text, calculators, electronic spellers, and communication devices. You can also use reminders and checklists to help with their memory, and also specialized instruction and clear directions. It would also be helpful to implement social activities. Thank you for listening in to this presentation, and here are some of the references that were used to help put together this presentation. If you have any questions, please feel free to reach out.